Good morning. I'm Patrick Erickson with the Inland COVID Response Joint Information Center. We appreciate everyone for being with us this morning. We will have our daily update from Spokane County Health Officer Dr. Bob Lutz. And this morning we'll also have Alicia Benson and Cindy Wendell with Greater Spokane Incorporated, along with Cheryl Stewart with Associated General Contractors. And this morning they'll be discussing the work the Business Recovery Group has been doing. They'll provide information on sector-based work that's now underway, and they also explain the right mitigation strategies being deployed right now in the construction sector. And of course, as always, we will be taking questions from everybody. If you have any questions for any of our speakers today, please share them with us on Facebook. And with that, we will start with Dr. Lutz.
Good morning. I hope you had a great weekend. Maybe get outside, do a little yard work. I found myself shoveling 5 yards of mulch this weekend. So again, it was a good weekend. Get out, spend some time with family, and enjoy the sun. So, we talk about the last couple of weeks have been very challenging for all of us, following the governor's stay home, stay healthy interventions, but we do see it working. As you know, the governor did release some of the restrictions, and we'll be talking about that in a bit. But let's look at our numbers first. So, Patrick? Recognizing that this is, again, yesterday's data, as of today, we have had 349 confirmed cases, and unfortunately 20 deaths, with one individual over the weekend who was in his 80s. And then the next slide. And this, again, demonstrates that we have had 65 hospitalizations, with 13 currently still in the hospital. So again, really encouraging data from my standpoint. As part of the governor's message, as we reopen the state, there are going to be some key areas that we are going to be following. We're going to be monitoring the data, acknowledging that really the only way we can be comfortable at safely opening is if we're looking at the data. We're going to continue to ask you to do all those mitigating efforts that we've been talking about over the past few weeks, that physical distancing, washing our hands, frequently touched is frequently cleaned, and of course, staying home when you're ill. We're looking to really ramp up the availability of testing. Now, this again continues to be a challenge. You've heard last week that we're looking at, if you will, standing down the county site at the fairgrounds. We're looking to be able to still maintain this site in some capacity, however, acknowledging that our healthcare partners have increased capacity across the community. So there's plenty of testing, relatively speaking. We still need to see more testing going forward. And one of the things we will be doing as we increase the amount of testing is that we will be doing more contact investigation. Now, stay tuned for this, but essentially what this will require is that if you test positive, somebody from either the health department or from Department of Health, some individual will be contacting you to find out about who you came in contact with. You will be asked to isolate at home because you have been identified, you've been diagnosed with COVID. But those individuals who you are in close contact with, they may get tested or they may be asked to stay at home for a period up to 14 days, because that's what we know to be the period of incubation for COVID-19. So again, stay tuned. There's more information to come around that, and we'll be talking about that with you as we get more information. So again, working collectively, following the science and the data, and again, practicing compassion, acknowledging that COVID-19 does not discriminate. But we also know that some individuals and some communities are more affected than others. And so we have to acknowledge that this is affecting everyone, just some more than others. So with that, I'm going to step aside, and I'll let Alicia Benson from GSI talk with you.
Good morning. It's great to be with all of you again. Alicia Benson, I'm the CEO of Greater Spokane Incorporated, and we're here today to share, I think it's a little bit of optimism for this Monday morning with the governor's announcement on Friday around construction, an opportunity to talk about the regional unified efforts around business recovery and really a plan for resiliency for this economy. This is work that we've been working on with many partners, including the county, our cities, business, our nonprofit and philanthropic community, the workforce, and of course, our public health partners. We're headed into week 8 of this effort. These efforts have initially been focused on assistance, relief, resources, and policy efforts for the immediate response for business. And now it's exciting to be able to shift to a conversation, discussion, and planning and preparation for our economic recovery and a conversation around reopening for our sectors. I want to urge patience. I know that we're all anxious for the economy to reopen. As we know, Dr. Lutz has been great about talking about the impact to both lives and livelihoods. Yet we're also in a position that we can really plan and prepare and do this in our best way possible. I also want to say that this work of planning and preparation has to be built on a trusted relationship between business and public health, more now than ever, because what we do know is that safety is going to matter significantly as we move forward, and that we have to build a platform that's focused on business confidence, worker confidence, and consumer confidence, and that if we do that, the success for our community and for our businesses is going to be much more significant. So this morning, I am excited to hand it off to Cindy Wendell, who is leading our Business Recovery Work Group efforts, to talk about some of the efforts that have been underway and also some of the tools that are being created. And then also an opportunity for you to engage with our partner at the AGC, who is on the front lines of really this conversation around reopening. And so with that, I'm going to turn it over to Cindy.
Good morning, everyone. I'm Cindy Wendell, and I'm working with GSI on our Business Recovery Work Group. And we have engaged upwards between 60 and almost 100 people in ways of talking and making sure that our business community feels supported and that they know that we're here for them and we're providing resources and tools for them. And as we look at the different ways and the areas that we are helping businesses, a lot of it revolves obviously around making sure that they have access to relief and understanding and inventorying what that financial relief is, what the relief that we can provide our business community as far as resources is as well, that's not necessarily financial. The assistance piece, how our businesses are connected, is very, very important. We need to make sure that they know that the resources are there and that they can utilize them. And so when our Business Recovery Work Group is really trying to do is cast a wide net and making sure that our entire business community knows where they can go for help and that we inventory what's out there and that we understand where the gaps are. And so a lot of our work has been around inventorying, and the work that we've been doing these prior weeks has been understanding what's been out there for everybody on a federal level, at a state level, and at a local level, and then understanding also is assessing that. The big important piece too for our businesses is understanding what isn't available and what they need, and the communication piece to be able to understand what they are going through, what our businesses and our employees and our customers are needing from us, and what we can produce and communicate out of where we see opportunity and where we see need. And the other piece too, again, I mentioned, is the connection, making sure that we connect businesses with the resources they need and the relief. And the big piece we're talking to this today and as we move forward is connecting partnerships. And right now it's really having great conversations about the partnership with the business community and public health. We have some certain deliverables that we've been working on that's very exciting for our business community at a local level, that they know that we're here to support them. One of the big pieces that we just launched on Friday is our Inland BizStrong tool, and you can find that at inlandbizstrong.org. It's a way for you to answer questions about your business, and at the end you will have a customized list of the relief and the resources and the assistance that is available to you from, again, a federal, a state, and a local level. Also, the city stood up a couple weeks ago our financial hotline. So again, this work group is really trying to uplift the things that other partners are doing as well, and making sure that the community knows what is there and a resource for them. Another great place to go is, of course, our regional COVID response website for businesses, which you can find at greaterspokane.org/COVID-19. In the weeks coming, we also have work streams that come out of this larger business recovery work group, and we'll be working extremely hard on our public health partnership and making sure that we answer the questions that our businesses have about how do we do this, how do we reopen, and making sure that that connection is there with the confidence that our employees feel good about going to work that the customers engaging with our businesses feel confident, that they will feel safe, and that we can provide an economy in Spokane that is unique to everyone else, that we will be the safest community to engage with our economy. And again, part of that piece too is sector by sector. And so I'm going to welcome up Cheryl Stewart with our construction industry and with AGC.
Good morning, everyone. My name is Cheryl Stewart. I'm the Executive Director of the Associated General Contractors. And yes, we were very excited on Friday to learn that the governor was opening up some construction projects. But I will say that as a result of a lot of hard work that has been done for over a month. And I'm going to chime off what Cindy said as far as partnerships goes. That was a result of a great partnership between industry and labor and state public agencies to develop a set of guidelines and a set of standards for what that would look like when we do go back to work and what we can do to keep our workers safe. That was our number one priority. We had some people still working, so we were able to test it out on the front lines, but construction has a little bit of an advantage. We are very good at mitigating risk, and to us, this is another risk that we have to figure out how to deal with. We've developed a very good standard of guidelines. Those are available on the governor's website. They're also available on our website that I think will help both our workers and the public know that we can open up and be safe. It's important to note this isn't just residential construction. We're opening construction by the risk class, not by type. So these construction projects are one where you can maintain social distancing of 6 feet, unless they are an essential projects. Those projects will continue to go on as well, and we'll be implementing all the same safety standards on those projects. It'll take us a little time to get up to speed. There is a lot of additional PPE that'll be required. Construction projects will look different moving forward. You'll see people with face coverings. You'll see some other masks if they're within close proximity of each other. Every site will have a COVID site supervisor, and I think this is very important. This person's job is to make sure that these standards are handled well and done by everyone. That is very important. Everyone has to embrace this and make these changes. And there will be mistakes. You will see people closer than 6 feet, and we'll have to remind them to move apart. That's why we have these supervisors on these sites. This is a whole new way of doing business. It's a whole new way of life for all of us. So we are learning, we are training, we are doing our best to get everyone back to work. And we learned a lot in this process. Again, we started early on. It was a great partnership to bring everyone together to discuss these guidelines. And we also shared a lot of best practices. This is something I can't emphasize enough, and I'm going to give a shout out to your trade and business organizations. If you don't participate in one now, I strongly urge you to look at doing that as a way to share these best practices. Public health and the health of your employees is not a competitive advantage. It is something we all need to do well, and we all want our competitors to do it well right now because we need to get people back to work and we need people to feel safe. So share those best practices. If you've figured out a way to keep people safe, please do it. Please share those resources. That's something this industry has done phenomenally well over the past few weeks. We've gathered those resources. We've made them available on our website. They're available to anyone, not just our members. And we're excited to get our industry lead the way back into this economic recovery. So I will step back and let people take questions now.
And our first question will be for Cindy. We have a question. How do small businesses get guidance on how to reopen?
Cheryl just mentioned a really good point, is reaching out to the industry that you are participating in is one way. We recognize, again, and this really goes back to why we're here, there are a lot of businesses out there that do not have those connections to trade organizations, to chambers, to other groups. And so we want to make sure that if you are part of a group, please connect with them, whether it is INBA, SIMBA here in our community, HANA, your neighborhood business districts, chambers and trade organizations. But again, the best way right now is our regional business website, which is greaterspokane.org/COVID-19. We will be continually updating that, and we bring in information from other resources as well and put that on the website. And there are ways to engage with Greater Spokane on that website as well and to ask questions. One thing I would really encourage that I didn't mention before is if you have not taken our sector survey yet, that is out on the greaterspokane.org website, please do that, because then we can provide more tools for you there on the website as we do get into more reopening.
Cindy, we have another question.
question that you can take. For those that may have joined us a little bit late, can you quickly recap where would be a comprehensive list for a small business to go to find out what resources are available to them?
I think the best thing to do, you've got the financial hotline with the city, and that you can call that. The phone number, actually, the city has a small business resource website as well. You can also go to the greaterspokane.org website. But for a comprehensive list, I think the best thing you can do right now is use our Inland BizStrong tool. And it's a digital tool. So you would just do a Google search for inlandbizstrong.org. And it is a digital tool that you will answer some questions, and that at the end, it will produce a customized list for you of all the resources that you have available, federal, state, and local. And it will have to do with financial relief, non-financial relief, and also the way you can connect. That's our best tool right now that we can provide for you.
And our next question will be for Cheryl. If we could find out how you're preparing and ensuring those safety protocols are being followed on job sites.
Yes, certainly. So a big piece of our guidelines to reopen construction, the number one bullet is the COVID site supervisor, whose responsibility is to ensure those guidelines are being followed. The second bullet point is about training. They will all undergo extensive training before anyone gets back to work, and that training will happen again weekly on what that new required PPE is. We also, our industry, we know that we're pretty good at policing ourselves. We'll be out there, we're watching it. We want everyone to be safe. And we also want the public to know that we are being safe and we're keeping them safe. So those two are the main ways we'll be doing that.
The next question is about budgets. How do companies stand to fare when looking at these new requirements on budgets? What are the projections as far as how these new policies will affect budgets for a project?
Budgets for a project, they will be affected. Frankly, there is additional PPE that will be required that will have an impact on budgets. There will also be an impact on schedules, which could affect budgets as well. We'll be staggering work shifts. We'll be staggering subcontractors, not having as many people on site at a time, which may take projects a little longer, all in the interest, again, of public health. So we'll have to figure out a way to deal with that. On the public sector side of that, I don't know what that will look like, if that will mean some projects are delayed, because we do have to figure out how to pay for these costs, but they do need to be implemented, and they will impact project costs and possibly future projects. You also have to look at, unfortunately, dwindling incomes of state and local governments that will play into that as well.
Our next question will be for Alicia, and we have a viewer curious, how does a business request assistance from the county's CARES Act funding?
Great question. So Spokane County just last week released a county-wide survey wanting to gather input from every county resident in regards to how those CARES Act dollars should be invested. That is a decision that ultimately the Board of County Commissioners will make, and so that tool is out on the SpokaneCounty.org website. It's also out on the Inland COVID Response website, and I urge everyone to take the time to fill that out. Give them your ideas, because our Board of County Commissioners is wanting to make sure that they understand what the needs are for this region as they think about how they prioritize these important investments of those $91 million.
One more question. How are your member businesses and businesses throughout the Inland Northwest working with public health during this time? And can you speak to the importance of that as we get ready to do a rollout?
Yeah, I think it's varied. I think for many businesses, they, until recently, they probably didn't have much of engagement with public health other than for some specific sectors where safety, food safety, and those kinds of things are involved. What we're seeing, though, that this time is bringing out really incredible innovation and ingenuity from the business sector. And I was just engaged in an email conversation over the weekend with one of our representatives from the Winery Association, who's talking extensively with the Health District about about their association, wineries, tasting rooms. And so I think that we're seeing businesses respond in that way. And I also think that this is a huge effort of the business recovery work as we move forward, is really making sure that we can build templates, guides that are completely informed by public health, but also then working with these different business sectors to deploy and get their business ready for reopening. Also, this is an opportunity to be thinking about much of what we've been able to practice during this response, which is things like telework and how is it going to look different. We know that things like social distancing are going to be a piece of our future, so there's a lot of that work going on right now, and this relationship with public health is more important than ever. And I think what you heard from Cheryl's comments with the AGC is that that's an example of a sector that's really thinking about safety first, so that we can then get people and business back to work.
Perfect. We'll round things out here with Dr. Lutz. Dr. Lutz, we have a question from our Facebook page about farmers markets. Should farmers markets be allowed to operate here in the near future? How will public health be involved in making sure that's safe for both the vendors and the public that are going to visit those farmers market?
Yeah, I think the question around farmers markets is similar to the comments that Alicia just made about public health, public and private partnerships. How are we going to work together? I think that in the past, many businesses haven't necessarily seen public health always as a partner, but going forward, for us to be safely opening up for both the vendors as well as for customers, there has to be confidence that where they are going is safe. And so I think as we open up, we are going to be seeing a greater partnership, and farmers markets definitely represent one of those partners with public health. Okay, we go to the cartoon. So I thought this was kind of funny this morning. Obviously, even physical distancing has made it to the comics, and so if you can't read this, it's Dilbert, who's one of my favorite cartoon characters, walking along, and he's walking on a road. Well, actually, he's walking on a bridge, and so he sees somebody coming too close. He gets out of the way, and in doing so, he jumps into the river. And there's a fish down there, and so for all of you avid fishermen, notice the fish is actually asking Dilbert to please give him 6 feet. So just thought it was kind of humorous. So with that, I say goodbye, thank you, but stay home, stay healthy, wash your hands, save lives. Thank you. Goodbye.